welcome to our webinar today titled Advancing Health Equity and Dementia, Introducing a New Public Health Curriculum. Thank you so much for joining us. My name is Eva Jackson, and I am an Associate Director with the Healthy Brain Initiative at the ALZHEIMER'S Association. And we are so excited to share the launch of our new public health curriculum with you today. Much of the work that we do on our team is for public health departments, but this curriculum is designed for public health students, educators, and professionals. And so we are thrilled to have so many of you from each of these diverse backgrounds here today. So welcome. Before we get started, there are a few housekeeping items I'd like to mention. So first, we are recording today's presentation so that we can share it with those who were unable to attend today. Second, if you'd like to use closed captioning, you can enable it using the toolbar at the bottom of your screen. And then third, we're planning to have a pretty full hour today. So we will be doing Q&A throughout. And if you have any questions during today's presentation, please put them in the Q&A box and our speakers or someone from our team will respond. And if your question does not get answered today, we will be sending out a question response document in the follow-up email after the webinar as well. So it will get answered there. I see folks are still joining, and we're going to go ahead and get started. All right, so today we will be talking about our new public health curriculum, Health Equity and Dementia, using a public health lens to advance health equity in Alzheimer's and other dementia. So first, I will share some background on the Healthy Brain Initiative and the development of our broader public health curriculum. And then we'll be joined by three amazing speakers. So first, we'll have Dr. Jolene Gardner, who's a senior professorial lecturer emerita of the Department of Health Studies at American University. And she has been involved with the public health curriculum for many years. Then we'll have Dr. Jason Flatt, who is an assistant professor at the University of Nevada, Las Vegas School of Public Health, and was involved in the development of this new health equity curriculum. And then we'll have Dr. Keena White, who is the director for the Office of Community Health Improvement at the Mississippi State Department of Health. And she'll be sharing how the public health curriculum overlaps with the work she leads at the Mississippi State Department of Health. And then we'll do a demo of the new health equity module to share with you how you can use this curriculum in your setting. I'd also like to acknowledge that the Healthy Brain Initiative and the development of this curriculum series are funded through our cooperative agreement with CDC. So first, a little bit of background on the Healthy Brain Initiative, or the HBI as we call it. The HBI is part of the public health team at the Alzheimer's Association, and we've worked to support infrastructure for brain health as we believe that everyone deserves a life with the healthiest brain possible. One of the ways we support this brain health infrastructure is through the publication of the HBI roadmap. And the HBI roadmap is a public health strategy focused on reducing risk and impact of dementia for the greatest number of people possible. So the updated roadmap was actually just released last month. And so if you're interested in learning more about it, reading it, or using any of the supporting resources, you can find them on our website at alz.org/HBI roadmap. And if you're using the HBI roadmap, this public health curriculum directly supports the outcome in the workforce domain to increase knowledge and skills of current and future workforce. So our intent is that this curriculum is something that can be used by you to support the work that you are doing with the HBI roadmap. So the development of this public health curriculum came from the work done in previous HBI roadmaps and in partnership with the Rollins School of Public Health and Emory University to build a diverse and skilled workforce to address dementia as a multi-layered growing public health challenge. In 2015, curriculum was developed under the guidance of an advisory board. And then in 2016, the curriculum was piloted with faculty from 15 undergraduate public health programs and then released in the fall of 2016 as a 4-module curriculum to be delivered by faculty in a classroom setting. And initially, the curriculum really was just intended for use in undergraduate public health courses. But once it was released, there was interest and uptake by advanced degree programs as well as interest from the current public health workforce. So then from 2018 to 2020, the curriculum was updated and a video component was added for each module, giving instructors the option to have students view the module content online, as well as have the activities completed in a classroom setting. So if you're curious about these original modules, they are currently available on our website. Do note that they have not yet been updated to include new information about treatment or diagnosis, and they are going to remain on our website until they are updated into our new online format in 2024. So today, we are celebrating the launch of a brand new online interactive module on health equity and dementia. And we'll be looking at this module more later today. So this is just the start. Later this year, we'll be releasing a new module on dementia caregiving and public health. And then in 2024, as I mentioned, we will be updating the original curriculum modules and moving them into the online learning format. So hopefully by this time next year, you'll have access to all new curriculum learning modules. So at this time, I'd like to go ahead and turn it over to our speakers to share how they have used or plan to use this health equity curriculum in their work. So first, we have Dr. Jolynn Gardner, who will be talking about undergraduate students in the public health curriculum. Dr. Gardner, as I mentioned, is a senior professorial lecturer emerita of the Department of Health Studies at American University. And she recently served as the department's associate chair, and she also directed the public health program for many years. So welcome, Dr. Gardner.
Thank you, Eva. I am so excited to be here with all of you. And I'm going to talk to you today about American University's history with the curriculum and also some recent work that some of my students undertook. So we were part of that original 2016 pilot program, and we piloted the curriculum in the public health capstone course that is part of our Bachelor of Science as well as our Bachelor of Arts. And then we've used the curriculum in multiple courses since then. This past spring, 4 of my students in my capstone class worked with Eva and Shelby to edit the original 4 modules, and then they also reviewed the new health equity module. And then they finally developed a communication plan for dissemination of the curriculum. So as I mentioned, at American University, we have a Bachelor of Arts as well as a Bachelor of Science. We've used modules in courses for both of those tracks, and both of our tracks, by the way, are also accredited. Just a few examples. We've used the curriculum in our Introduction to Human Health and Disease course. We've used parts of it in the program planning and policy courses. And as I already mentioned, I've used it extensively in the capstone class. So these comments on this slide and the next slide actually come from 4 of my amazing students who worked with Eva this past spring. And when they reviewed the curriculum in its entirety, they had the following 3 points to make. They said from their perspective, the curriculum was extremely informative. It's based on current research and practice. And obviously, as Eva already mentioned to you all, it's constantly being updated and will continue to be updated in the future. It's substantial, and I can attest to that as an instructor. It provides a wealth of information and detail, and it's very engaging. And it's also customizable. So as I mentioned, we've used the curriculum in several of our courses, but for instance, the Introduction to Human Health and Disease really just uses that that portion of the curriculum that focuses on human health and the biology behind Alzheimer's. And so that's the beauty of this. You can use as much of the curriculum as you need to. Next slide. My capstone team also said from the student perspective, they thought that the curriculum really, once again, provided this incredibly comprehensive, but also understandable overview of Alzheimer's disease and other dementias. they really felt that there was a connection between the public health competencies that they were being asked to master in our curriculum to new and emerging issues, for example, in the areas of Alzheimer's disease and dementia. And then, as I've mentioned a couple of times, they just really liked the curriculum. They said it's flexible, it's engaging, and it's written in a manner that it really resonates. Couple of comments from students over the past few years, actually. This isn't just my capstone team, but students who have had the benefit of being exposed to the curriculum have said that they feel that it gives them a very good understanding of the issues. And I also thought this was an interesting comment. One of the students said, obviously, we've all heard about Alzheimer's disease, but I never realized its impact and what a significant public health issue it is. And so I think that is just an incredibly valuable takeaway from what the students have to say about this. Next slide. And so finally, to wrap up my section of this, recommendations for educators. The first thing is go to the website and access the curriculum, review it, use what you can, and then utilize the curriculum to prepare your students to be part of our growing public health workforce. Thanks, everybody.
Well, thank you so much, Dr. Gardner. Thank you for your partnership and your support on this project for so many years. It's just been truly a pleasure working with you and with your students. So our next speaker I'd like to introduce is Dr. Jason Flatt. Dr. Flatt is an assistant professor at the University of Nevada, Las Vegas School of Public Health. And Dr. Flatt's current research works to better understand concerns and needs of diverse LGBTQIA+ people living with Alzheimer's disease, Parkinson's disease, and their care providers. So welcome, Dr. Flatt.
Thank you so much. I'm really excited to talk with you today about some of the curriculum, and I'll be focusing a lot. I'm really excited that the new curriculum includes LGBTQ+ populations. So next slide. So I wanted to start us off with some terminology that we're really emphasizing, and it's important that we think about health disparity populations that are impacted by Alzheimer's disease and related dementias. So we think about the terms sexual minority. This represents people who do not self-identify as heterosexual. So they may identify as asexual, bisexual, gay, lesbian, or queer, or they use a different term. We also are thinking about our communities who are gender minorities. These are individuals who do not identify their gender identity with aligning with what social and cultural expectations set to people based on their sex assigned at birth. So this can represent transgender people or non-binary people, as well as intersex people. These are individuals who are born with differences in their sex development. And so they're often considered as gender minorities, and it represents about 2% of the population. We also talk about when comparing to other individuals, we'll use heterosexual or cisgender, and cisgender represents people whose gender identity aligns with the sex assigned to them at birth. I show this image on the left of just the diversity of terms to reflect that. And I think it's also important that we think about assessing sexual orientation and gender identity in the work we do. And we also know it changes over time. So I wanted to emphasize sort of what do we know about the impact of Alzheimer's disease on the community? Well, we know that at least, right, there are nearly 3 million LGBTQIA+ people in the US that are over the age of 50. And we know that at least 7% or more of them are living with Alzheimer's disease or a related form of dementia. There hasn't been good data collected. So we know that the estimates currently are really crude, but we do see some really unique concerns around risk factors for Alzheimer's and related dementia. So aspects like higher rates of depression. We know that if you have depression in late life, you have a twofold increase in risk for dementia. We also know that people that are living with Alzheimer's disease face unique challenges. So we know many of them do not have the support they need. They may live alone, and they also face unique economic challenges. So Alzheimer's is the most expensive disease in our country. And we know that many LGBTQIA plus people are living on a fixed income or may not have enough money to live. And then when it comes to accessing care, we see that many people are concerned. They don't talk to their healthcare providers about their identities. And we think this is especially a concern if they have early memory loss or Alzheimer's disease. If you want to learn more, I encourage you to check out the issue brief that was published by the Alzheimer's Association and SAGE Advocacy and Services for LGBT Elders. So I also want to highlight some work, and I think that this is really exciting for me. It's something I bring to my course, but as part of the Healthy Brain Initiative, we have the opportunity to have data across our country from the Behavioral Risk Factor Surveillance System. And back in 2015 through 2018, states asked about sexual orientation and gender identity. And we're able to use this data to look at one of the Healthy Brain Initiative modules, looking at subjective cognitive decline or self-reported problems of worsening memory. And so we find actually for LGBTQ plus people, higher rates of them endorsing having these memory problems. And then we also see that these memory problems impact their everyday lives. I've talked about both the social and economic challenges. And so we see this playing out with this BRFIS data that we're able to use. And I have found this really valuable in talking to my students around the concerns and how to use the data. So next slide. I also want to encourage you to think about some of the efforts to look at caregiving. So also the Healthy Brain Initiative has promoted a module in the Behavioral Risk Factor Surveillance System to look at caregiving needs. And something unique we see for many populations is that they do not have access to caregivers, or their caregivers are taking on a bulk of that care, more likely to do things like nursing tasks or high intensity tasks, as well as caregivers are reporting that their health is getting worse. And we know that LGBTQIA plus people are more likely to become a caregiver compared to their heterosexual and cisgender counterparts. So I encourage you to check out some of the efforts with the Alzheimer's Association focused on LGBTQ plus caregivers. So I want to share more unique data where I talked about the behavioral risk factor surveillance system data and looking at caregiving. And again, another piece I can bring to my courses when I talk to students. So we are seeing unique challenges and also in terms of unique rates. So 1 in 4 LGBT adults are reporting that they're a caregiver. They're also more likely to report that they're having to help with assistance with care for their care recipient, right? And also we see a high number of future caregivers based on this BRFIS data. So 1 in 5 LGBTQ plus people that aren't currently a caregiver are expecting to become a caregiver in the next 2 years. So again, this emphasizes the need for programs and public health initiatives to think about caregivers of people with Alzheimer's disease. We see from AARP really unique challenges, concerns around being able to access affirming long-term care services, right? Affirms or concerns around being able to afford this, right? And also the unique challenges, right? Caregivers feeling more stressed, finding it difficult to manage their health and get enough sleep. So there's some really unique opportunities to share this data with your students and other constituents about the unique needs of caregivers. Next slide. I also want to just shout out some resources that are out there. So the Alzheimer's Association shares this in the Healthy Brain Initiative information, but really check out ALZ Connect. It's a great way to connect those who are a caregiver with different resources. There is a group specifically for LGBTQIA plus people. I also want to give a shout out to SAGE. They have a national resource center. We highlight those resources in the new curriculum, as well as the opportunity to leverage some other resources like the Elder Care Locator, the LGBTQ plus Caregiver Center, and then the LGBTQ plus Healthcare Directory. So definitely check out these resources for the LGBTQ plus community. Next slide. So I want to do also a shout out, really this work and the opportunities to do more research on the community. We currently have a study funded by the Alzheimer's Association that is recruiting LGBTQ plus and non-LGBTQ plus older adults or people age 50 and older. And we're looking at memory and thinking. Really, the data from the BRFIS has been motivation to learn more. And so I'm really excited that the Alzheimer's Association is supporting this work. So next slide. So I wanted to share a little bit, how do I use the curriculum with my students and specifically public health students? I teach across sort of the gambit of undergrad, master's, and PhD. And I think this new curriculum is really amazing in terms of really giving our students practical examples of how they can tie this learning around, healthy brains, Alzheimer's disease, to the public health prevention work that we do. There are also some really amazing examples if you're looking for aspects for your curriculum to tie to health equity. We give definitions of what health equity is. We give examples. We give opportunities to look at data in this curriculum. So your students are also going to have an opportunity to learn and play with data. So I mentioned the behavioral risk factor surveillance system. I often give my students an opportunity to play with the most recent version of the BRFIS and look at what we have included with the Healthy Brain Initiative. I also want to encourage you to think about leveraging this new curriculum for your own teaching. So the curriculum provides you with really amazing learning objectives to think about things like health equity, health disparities, diversity, a range of areas that really impact health over the life course for our populations. They also give some great examples if you are teaching, let's say, online or you coordinate a discussion board. There are some really great case studies that I've used. I can put those into my own curriculum, right, and have students really think critically about them and apply some of the learning from your course or concepts to these case studies. So for instance, there's one focused on like urban and rural differences. And then finally, I encourage you to check out the instructor guide that we provide. There are multiple choice questions built into there that you could also use in assessing the learning and knowledge gain of your students. So conclusions, I want to encourage you just to check out this new curriculum. I've shared with you the unique needs for the LGBTQ plus community. I want to encourage you to think about collection of sexual orientation and gender identity and learn from what we put in there. Leverage the research, the BRFIS, some of these unique data points. And I just thank you for being here and encourage you to mentor your students about learning more about the Healthy Brain Initiative and specifically our work in equity. So next slide. So I just want to thank you. I have no conflicts of interest to report, and I am going to pass back to Eva.
Wonderful. Well, thank you so much, Dr. Black. And thank you for sharing so much about your expertise and the perspective you bring to health equity and the perspective that you've brought in the development to the roadmap as well as this health equity module. So we really appreciate it. So finally, we'd like to welcome Dr. Kina White today, who will be talking about the work at the Mississippi State Health Department and its overlap public health curriculum. So Dr. White is the director for the Office of Community Health Improvement at the Mississippi State Department of Health. And Dr. White has a sincere passion for working with underrepresented communities and improving equitable access to quality care. So welcome, Dr. White.
Thanks, Eva. So it's such a great opportunity to be here today. And so thank you again to Eva and the Alzheimer's Association for this opportunity. Next slide. So I just want to level set. We've heard a lot about how you can do the next slide, Eva. So we've heard a lot about how this curriculum can be used in the academic settings. But what I want to share is how, as a public health department and in the business arena, how this curriculum can also be integrated. So I'll share about the Building Our Largest Dementia CDC program and how we're utilizing that program and how this curriculum will be impactful in that work. And then share some statistics and how we're going to integrate within our state efforts. Next slide. So for those who may not be familiar, the BOLT program, which is the Building Our Largest Dementia program through the Centers for Disease Control and Prevention, began in 2020 for public health departments. Mississippi was one of the recipients of that initial grant program. And what we focused on is really thinking about brain health as a public health issue, looking at early detection, looking at risk reduction, looking at those comorbidities and avoidable hospitalizations of individuals diagnosed with Alzheimer's, but also, as Dr. Flatt mentioned, using data for action, looking at the behavioral risk factor surveillance system and utilizing that data to actually make dementia-specific actions. Support for caregivers is also highlighted in that effort. And then with a new opportunity fold efforts, we are now addressing the social determinants of health through health equity, including community clinical linkages. And so I'll share how in Mississippi, we are going to utilize this exciting curriculum to do that work. Next slide. Just to level set with statistics, we often talk about the burden of Alzheimer's disease. And yes, as Dr. Flight said, it is the most expensive disease to treat. But thinking about our caregivers, we definitely have an unreported, unrepresented number of caregivers. But if you just look at the cost, the $2 billion cost for value of unpaid care for caregivers supporting loved ones, something that stands out is 69.3% of Mississippi caregivers also had chronic health conditions. What we find are caregivers often will place their health aside to take care of their loved ones, and then they ultimately will have chronic challenges and illnesses. And so thinking of how we become more equitable in our support for caregivers is also, I believe, a way that this curriculum will help. If you think about our mortality across Mississippi for Alzheimer's and dementia, in 2019, having 1,662 mortality or deaths in the state is quite alarming, and I'll tell you why in a slide above. But we are limited in our workforce. We only have less than 25 geriatricians across the entire state of Mississippi. So thinking about equitable care and needs for the Alzheimer's population is so startling for our state. Next slide. So Mississippi is in fact the brain health hotspot. Hinds County, which is within the capital city of Jackson, Mississippi, is now fifth in the nation for Alzheimer's cases. And Mississippi is number 2 in the country for Alzheimer's deaths. And so it is quite alarming to understand the need of addressing brain health as a public health issue. And so definitely understanding Mississippi is a very rural state and some of the disparities that exist within our state and how health equity and understanding health equity will help to address some of these needs. Next slide. So we have a very robust state plan coalition that works tirelessly to address this work. And so as illustrated, we have a number of executive steering committee members, but we also have representation across home health, behavioral health, academic platforms, et cetera. And the first place that we feel this curriculum will be helpful is level setting health equity in our state plan dementia action. And so with all of our leaders and members, we will encourage them to complete the full curriculum in its entirety. And for those who may not have the availability to go module by module and just complete as they can, we encourage all of our new members to the coalition to complete the current Alzheimer's disease curriculum, as well as the dementia caregiving curriculum. And as we've heard from Eva, some of these will be updated. But the goal of this is to really have an understanding for all of our coalition members, exactly what our goals are to address those social determinants of health. And utilizing this curriculum will do just that. It'll be in a very concise manner, a way that all of our volunteers can really understand how health equity is not an isolation of, but an integrated component to all of our statewide dementia care actions. Next slide. Something unique that we did in the course of development with the BOLT program is we identified what we call health equity ambassadors. We have 5 goal groups, which are similar to committees for our state plan coalition. And so what we've done with each of those ambassadors is provide them with cultural competency training and really work through understanding strategic actions for each of their committees. And now we see this new health equity curriculum as an additional training component that we can add to their volunteer role so that, again, they are able to, within their committees, be that ambassador and that voice to integrate those necessary actions. So if we're understanding our communication messages and we're talking about health literacy, having that person in community awareness speak up to ensure that we have the appropriate culturally responsive messaging that we need to have for those target populations. And our brain health group, making sure that when we talk about our inequity symposium, that we have the right representation. So this curriculum will really provide an opportunity of increased awareness and understanding throughout all of our dementia state planning. Next slide. for public health specifically, something that we would love to see more of and that we're going to utilize this curriculum to do so is offer insights for the lifespan life course approach. Thinking about brain health, it is so important that we do think about the life course approach and really looking at risk reduction and how we work with other chronic programs to really address healthy brain in that work. This curriculum also gives an excellent opportunity to look at cultural competency, a better understanding to the workforce for structural bias, and the ability to understand cultural awareness as we're doing public health programming and policy development. And so that's something very critical to public health that this curriculum will allow the opportunity for, in addition to hiring for students. Many of the students who graduate from the programs that you all just mentioned will work in public health, and many of them will work at local and state public health departments. So understanding that they have those professional competencies in their academic platform will then transition to them actually working in the public health department. Specifically related to policy and accreditation, with the Public Health Accreditation Board, there are specific elements of the curriculum that apply. Specifically, health communication strategies, as I shared, looking at prevention, health, and well-being, but also making sure that a competent workforce is prepared to address cultural humility. Looking at tribal and local public health department workforce is so impactful, and this new curriculum will allow us to level set in that way. And so it's really exciting to see FAB and CFA and others integrated within this curriculum. Next slide. Some additional health equity strategies to consider for local public health departments or state health departments is as we think about addressing social determinants of health. Many of us have community health workers that will be trained on how to connect individuals in the community addressing transportation issues, access to care issues, medication therapy and management, and just making sure those connections are there. Having them have this health equity curriculum as a resource will help to better reemphasize and understand the importance of addressing those determinants. Dr. Flatt mentioned about data. Linking data to address inequities is very critical. We have 2 BRFS modules, the behavioral risk factor surveillance modules that are used, one being the subjective cognitive decline and the other the caregiving module. And having this curriculum reemphasize the need to understand the data and how that data is linked to addressing inequities is very important. Social isolation is something that is quite critical to public health. And post-pandemic, we very well understood for older adults the need to addressing social isolation. So I'm excited to see that this is included within the curriculum, but also understanding that public health can collaborate with their area agencies on aging and really talk through exactly how we support our older adults and help them from being socially isolated and lonely. Another area of strategy for this curriculum in public health departments is health promotion, education, and outreach. Definitely the implementation, as we're implementing our evidence-based programs and intervention, the curriculum will provide examples of different evidence-based programs to support caregiving and other facets of care that'll be really helpful for public health departments. With our BOLD work, we work very closely on brain health, heart health, brain health, diabetes, brain health, healthy weight. And so this curriculum will allow, again, an opportunity to integrate across programs. And instead of working in silos, but really working comprehensively to address the whole person approach. And so looking at our lifestyle change programs, I think this curriculum will just provide a great complement to work that's already happening, but have that integration of brain health as such an important factor. Again, working with faith-based organizations, Ultra Dementia is an excellent faith initiative out of Georgia State University and Emory University. And again, this curriculum could complement what's happening in that community by also educating on health disparities and inequities. Because as we know, African Americans and Hispanics are definitely disproportionately affected by an Alzheimer's disease. So being able to have this curriculum in that space is so exciting. And again, we've heard about partnering with academic programs. I also want to mention 2 last points. Working with dementia-capable systems and dementia-friendly communities is another space in which we can integrate the utilization of this curriculum and working with our state units on aging to look at this. And something really exciting is working with our age-friendly public health system. Trust for America's Health has done a phenomenal job of developing a great system to create age-friendly public health systems. And so we see public health being able to utilize this curriculum as well as a complement of understanding, and then working with AARP in those age-friendly communities as well. And lastly, caregiving is not a least thought. It's so important, and caregiving is now a public health issue. And so we see how this curriculum will really provide a pathway of understanding of how to support our caregivers and provide them with equitable care. To the right, you'll see an infographic of paving the road to health equity. And so in public health, just really thinking through your programs, your data, and your policy, and how this curriculum provides a level set opportunity to really support health equity at the local level. Next slide. So I just want to give some acknowledgments to some great partners in Mississippi for our work. Of course, the Department of Health, the Mind Center at UMMC, with our state plan leaders and our members. We also have something called Caregiver University that the Mind Center leads, and it's an excellent free virtual university platform for caregivers to take time and understand the needs that they have and be able to provide resources for themselves and learn about the various needs transitioning through caregiving for someone with Alzheimer's disease. Our Mississippi Alzheimer's Association chapter is a great partner, as well as our Department of Mental Health. So all the work we do is with this amazing team. So I just want to give them that acknowledgement. Next slide. And just thank you all for the opportunity and just look forward to the conversation. And Eva, I'll turn it back to you.
Thank you so much, Dr. White. Thank you for sharing about the work that you're doing and how this work can be useful for public health departments in many different settings. And thank you again to all of our presenters today. Really appreciate the different perspectives and expertise that you've shared. I know I always learn so much when I think about how this tool can be used by different people in different settings. And so we just really appreciate that diverse experience and that expertise that you've brought. So I'd like to take some time now to go ahead and walk through how you can access and share this health equity module. So to access the curriculum, the first thing you can do is go to our website at alz.org/public health curriculum. And if you scroll down a little ways, you will find the health equity module. So here you can read some information about the module and then find some additional resources. So the first resource that I'd like to highlight is the instructor guide. Dr. Glatt mentioned this, but it's designed as a supplementary resource for instructors to use to just complement the material that was learned in the interactive module. So the activities included in the instructor guide include discussion questions, learning activities, some sample test questions, case studies, video resources, graphic resources, additional readings and resources. So anything that you might be able to use to adapt the material to make it really useful in your interactive classroom setting. And the second resource I'd like to point out is the Health Equity Module Flyer. So this flyer is just a short, succinct way to share information about this Health Equity module with anyone else who you think might be interested. And then I would also like to point out the sign up button there to the right. So this is where you can sign up for our e-news. That's where you'll get the most up-to-date information on our products and resources, which includes the curriculum modules and those updates that come out as they're released. They will be announced in our e-news. And then finally, there's the link to the health equity module itself. So if we go ahead and click on Start the Module, it brings us to the Alzheimer's Association's Learning Management System. So please note, you can get here just using the link at the top of the page here. I just personally find it's easier to go through the link on our website, and that has all the other resources as well. So if you've done any training with the Alzheimer's Association's Learning Management System before, you may notice our brand new Public Health tab. So which we are very happy to have this. And this will be the home for all of our resources as we continue to build them out. So in order to access this and other free education opportunities from the Alzheimer's Association, you do have to log in with a free account. So when I first get to this page, I always recommend logging in first, as it makes finding all of the courses that I've started or completed just a lot easier. So if we do click on login and register, it will bring us to this login page. And again, if you've used the Alzheimer's Association Learning Management System before for other trainings, you can just enter your existing username and password on the left and click login. If this is the first time you've used the system, you can click on create account there on the right. And then once you have an account, it's really easy to access and keep track of all of the resources available on the learning management system. So after you've either logged in or created an account, it will bring you back to this page, which looks familiar. And now, though, you can either click Add to Cart, which will be in this location, or view enrollment if you've already started the learning module like I had. So after you click Add to Cart or view enrollment here, it will take you to this page where you can launch the interactive module. So when you do click launch here, it will take you into the interactive module. So I'm just going to note up front, this module does save your progress, so you can return to it whenever you like. And today I'll just be sharing a taste of some of the interactive components offered by the module and just really encourage you to go check it out for yourself. So in this module, you'll read through many different topics, including all sorts of activities throughout as you go. One of the activities you'll see here are flip cards. So for example, these flip cards shown here show different characteristics that may impact health equity for people, some of which were mentioned by our speakers today. Another activity throughout is knowledge checks. And so these knowledge checks do ask learners questions about what they have learned, but their scores are not used to track completion or tied to their learner account. The intent is really just that these are a moment for learners to pause and apply what they have been learning. So each question provides an explanation at the end and then allows learners to retry the question if they want to. One activity here that was mentioned as well by our speakers is the importance of life course approach. And so here we have the life course graphic in which learners can move throughout different life stages to see how health equity and dementia fit into the role of public health across the entire life course. And then this activity here is really cool. It's an interactive map, so learners can see how public health is advancing health equity in dementia at the local, state, and national levels. These are examples of things that are happening. So learners can click on different examples to learn more about each pushpin on the map. And then we also have short videos throughout, provide information, resources, and the voices of people with lived experience. So while we are addressing health equity and dementia from the population-based perspective, we want to ensure that learners are still hearing from individuals who are living with dementia. So when a learner has completed the entire module, this short survey here is unlocked. And this survey is a user experience survey, but it does ask about what was learned and how it will be applied moving forward. And as many of you know, being grant funded, we greatly appreciate the responses and the feedback that we received through the completion of this survey. And for our early adopters, we've included a few questions about the interactive module experience, which we will remove later. But this is the first in a series of module developments. And so we want to know what you liked, what you didn't like, and we'll use that feedback as we develop the next modules. And then once that survey is completed, the completion certificate here is unlocked. So if you click to print that completion certificate, it provides you with a PDF of a completion certificate with the learner's name and completion date. So this is something that learners can print or they can share with their instructors or trainers to demonstrate completion of the module, since it is only available once the entire module and the survey are completed. So speaking of surveys and how valuable they are to us, we are going to be sharing the link to our short evaluation survey for the webinar into the chat, and we would greatly appreciate you completing it with your feedback. And you'll also have the opportunity to complete this survey when the webinar ends or using a link that will be in our follow-up email. And so I'd also like to thank our speakers again today for joining us to share their perspective on the public health curriculum and the work they do with current and future public health professionals. And I'd like to thank the staff and the students who helped make this curriculum launch possible, and to thank all of you for your participation and questions today. We did really good on time, so I do think we have a few minutes for questions if we have any that we'd like to go through.
Yeah, that's great. Thanks, Eva, and thanks so much to all of the speakers. This was a really wonderful overview, and there have been so many questions coming in, so I can see that everyone is really excited to dig in and to use this module. Eva, I think the most common question that came in was about if this module is appropriate for the public. So I wanted to see if you could go over again just who this is intended for and then where people can access information that could be useful to them to use with the public as they go through the module.
Absolutely. Thank you. Yeah, so the curriculum really is designed for public health students and professionals, for that public health audience. It provides a training of health equity and dementia from that public health population-based perspective. It is obviously on our website, our learning management system, so anybody is welcome to use it. But there are so many other great resources as well on our learning management system that are really designed for somebody who is caregiving or somebody who maybe is living with dementia. So it is available for use, but it really is designed for that public health perspective. And we are happy to share some of those resources as well in our follow-up email that goes out.
Yeah, and we are excited to have wonderful professors like Dr. Flatt and Dr. Gardner who are now teaching this in their classrooms. But I know when I went to public health school, this wasn't something that we went over. So I really appreciate these resources and how Dr. White is using them with her staff to just, for us to be able to be out in the community and designing programs that address these issues. It's important that we understand them. So I think this is a great first step for that. And then Eva, of course, everyone's really interested in when they're going to get the follow-up of the recording and the slides. So I did just want to take this opportunity, since we have a few minutes, to let everyone know we will send a follow-up email summarizing a lot of the questions that we had come in, and we will share the recording. And with everyone's permission, we'll share the slides that were part of the presentation today. Dr. Flatt, Dr. White, Dr. Gardner, any questions that came in specific for you all in your presentations that you think would be useful to share with the group?
I have one. So one did our online caregiver university, because I know that caregivers are such an important element of everything we do for Alzheimer's disease. I was asked if that was specific only to Mississippi, and it is not. Our academic medical center, Center for Telehealth, has allowed the expansion of that caregiver platform for others. So I did place that link in the chat for that recipient, but I can also place it in the larger chat if I need to, Shelby.
Great. Yeah, we'll be sure to share that with everyone when we send out. Dr. Flatt, did you have something you wanted to share?
Sure. I think there were some really good questions in there about, how the curriculum addresses like the social determinants of health, and specifically thinking about sort of like aging or like life course aspects. And so there's some really amazing, I encourage you to check out the curriculum, especially we shared the instructor guide, and we really thought about this curriculum in terms of the social ecological model and also applying this to life course issues. And then for social determinants of health, I wanted to just give a plug to check out those case studies that we developed. They're going to be really amazing for you to be able to take them to your course and really think about, if you're teaching about social determinants of health, you'll be able to apply these to the case studies and have discussions with your students or with your staff about how these are relevant. So I just wanted to give a plug for those.
Thanks for doing that. And before I turn it back over to Eva to close it out, I do want to say a huge thank you to Eva and to the Emory University team who developed this curriculum. I think as you all go through it, you'll see it is new and different and interactive, and just I think you'll really be able to feel the thought that went into each of the activities and the text that you see there. And that's a great job by Eva and her team for getting that accomplished and on the internet for all of you to use. Eva, I'll turn it back over to you.
Thank you. Thank you so much, Shelby. Thank you for everyone's questions as well. We really appreciate those. And yeah, so please just feel free to start using and sharing the curriculum. I know we've had over 50 people logging in using it already. We had at least 10 people who had completed it as of this morning. So that's really encouraging to us to know that people are using it and it's being useful to folks. So I will also mention, so on our website, we have this short video, and it just provides a brief overview of the broader curriculum, kind of similar to what I have shared today. So we're going to go ahead and end our webinar today by watching this short video. Like I mentioned, you will get an evaluation when the webinar ends. Please do take just a few minutes, fill that out for us, and then keep an eye out for the follow-up email. It'll be coming out shortly. So yeah, I'll start the video. Enjoy.